Hi everyone, I'm Emma Eggleston, the Dean of the WVU School of Medicine Eastern Campus. So for tonight's mini med school, we're very fortunate to have Dr. Apoorv Prasad talk with us about the neurologic complications of COVID-19. Dr. Prasad is one of our neurology faculty and has published on the characteristics of the neurologic complications of COVID-19. So tonight he's going to run us through the epidemiology and the pathophysiology and treatment of the neurologic complications of COVID. He'll also take us through the syndrome that you may have heard discussed as long hauler syndrome, meaning long-term complications of COVID-19 that can affect even people with mild original cases. So I think we'll have a lot to learn, and thank you very much, Dr. Prasad.
Good evening, everyone. My name is Apoorv Prasad. I'm Assistant Professor of Neurology here at WVU East in Martinsburg. I have been given the opportunity to talk about a very important topic, which is neurological complications of COVID-19 infection. It's been more than 1 year since we have all braced this pandemic, and all of us can see light at the end of the tunnel. However, we are still learning a lot about this virus. Definitely, SARS-CoV-2 virus is like no other virus which we have ever encountered before. So today, we are going to learn about neurological complications of COVID-19, which is a very important topic to know about. So this is a basic outline of my presentation. We are going to know and learn about evidence from other viruses. We will learn basics of nervous system and neurological investigations. We will learn why do neurological complications happen. Then we will learn about types of neurological complications and their treatment. What is the prevalence of neurological complications in COVID-19 infection? What it means to be a coronavirus long hauler. What can we do when we face neurological complications, and how can physicians guide you? And conclusion. So first, let's know and learn what is the evidence from other viruses we have. Is SARS-CoV-2 the only virus which causes neurological complications? And the answer is that it is not. So before SARS-CoV-2, there have been 6 other coronaviruses which have infected humans. 4 of these cause seasonal mild respiratory illness. 2 of these are more well known, the SARS epidemic in 2002 and MERS in 2012 have caused major epidemics. What was the prevalence of neurological complications in these viruses? So it was not that much. It was about 1 in 1,000 for SARS and about 4 in 1,000 for MERS. Apart from the coronaviruses, another epidemic which we knew about was the H1N1 in 2009, and that caused about 1.2 per 100,000 neurological complications in individuals, and unfortunately, children were more affected than adults. Now let's learn a little bit of neurology so that we can understand neurological complications a little bit better. So what are the basics of nervous system? So the nervous system is composed of 2 major parts. One is the central nervous system, which is displayed in orange. So it comprises of the brain, it comprises of the spinal cord. And this is the main central processing unit of our body. Then we have the peripheral nervous system, which is displayed in yellow. And this is composed of the cranial nerves, the spinal nerves, and the peripheral nerves. And these further contain the sensory and motor neurons. And in a nutshell, these are the wires which are transmitting information to our body. Further, let's learn a little bit about the blood-brain barrier. about how the blood vessels in the brain are different from that in the body. So the blood vessels in the brain have a covering which protects the toxins to go further inside the brain. And this is an important concept to know because it has implications in neurological complications as well as other neurological diseases. What are the neurological investigations which can be performed when we encounter a patient with neurological complications? So as neurologists, we can order brain imaging. Over here we have a CAT scan, and over here we have MRI. Now CAT scan comprises of radiation. It's a quicker test. It's less cost. However, it does not give us the best pictures of the brain. Whenever we want the best pictures of the brain, we need an MRI, which is called magnetic resonance imaging, which has less radiation, more time, more costly. Another test, which I'm sure a lot of people have heard, is the spinal tap or lumbar puncture, which is very important to get the cerebrospinal fluid or the fluid which is surrounding the brain and the nerves, and that can give us a lot of information about what's going on in the brain and the spinal cord. Another test called the EEG or electroencephalogram is a brain wave test, and this helps in to see if a person is having seizures or not. So now that we have learned a little bit about the basics of the nervous system, and we have also learned what investigations can be done, let's learn about how and why do neurological complications happen. So in order for someone to have neurological complications, of course, number one, the patient has to be infected with the SARS-CoV-2 virus. In order the person to be infected, the virus has to enter our body. The most common route for entry is directly through the nose. However, our olfactory bulb, which is a cranial nerve in our nose which is responsible for the smell, is not protected by a covering, so it's easier for the virus to enter our brain directly through that. Then we had discussed about the blood-brain barrier before. So the virus can also leak through the blood-brain barrier if there is an infection going on. Lastly, there is a receptor called the ACE2, which scientists have discovered, and the virus can attach to this receptor, which is present in the muscle and the brain blood vessels, and further enter our body. So what are the mechanisms of disease itself? So number one, the virus entry causes infiltration of immune cells, and it releases inflammatory chemicals called cytokines and chemokines. I'm sure you must have heard the term cytokine storm. And this inflammation responsible for generalized tissue damage, but also damage to the brain cells or neurons. Data so far has not highly suggested that virus is directly capable of causing destruction to brain cells, unlike other viruses like herpes. So now that we have learned how and why the disease or the neurological complications happen, let's learn a little bit about these neurological complications. So number one is encephalitis. So encephalitis is inflammation of the brain with clinical evidence based on the tests like we had discussed earlier, like CT scan, MRI brain, spinal tap, and EEG. So all these tests are abnormal when a patient is having encephalitis. It's usually caused by an infection or can also be caused by the body's immune defenses. So what are the symptoms of encephalitis? The symptoms include irritability, confusion, reduced consciousness, psychosis, neck stiffness, very high fever, and can sometimes be associated with seizures. Treatment. For SARS-CoV-2 encephalitis, there is no specific treatment. However, steroids, anti-seizure medications, and supportive care in intensive care unit with Tylenol and close monitoring is recommended. The second complication is encephalopathy. So how is encephalopathy different from what we just learned as encephalitis? In this condition, the brain inflammation has not been proven. So patient can have major symptoms like changed personality, behavior problems, cognition, or consciousness problems including coma. However, we do not see the abnormal findings on imaging or spinal tap, or EEG does not show seizures. The wide range of causes which can cause encephalopathy include lack of oxygen, drugs, toxins, as well as electrolyte imbalances. The treatment for encephalopathy is you treat the underlying problem. So you get the oxygen saturation up, you remove the drugs, you remove the toxins, and also correct the electrolytes, which can be seen a lot in SARS-CoV-2 infection. So now let's learn about acute disseminated encephalomyelitis. So it is a syndrome which is caused by multifocal areas of brain damage, which presents with symptoms similar to encephalopathy, but also can cause paralysis and can sometimes look like a stroke. It's usually considered post-infectious, meaning it can happen weeks after the SARS-CoV-2 infection. This condition can be very serious and sometimes even life-threatening, and it is very important that the physicians recognize it earlier, because earlier treatment with corticosteroids, a medication called intravenous immunoglobulin, and other immunotherapy like plasma exchange can reverse this condition. Now let's talk about peripheral nervous system and muscle complications. I'm sure everyone must have heard the term Gyaabari Syndrome. What is this syndrome? It's characterized by rapidly progressive symmetrical limb weakness, sensory symptoms, and facial weakness in some patients. The tests which can be done to figure out this condition include a spinal tap as well as a nerve conduction test. The treatment is similar. Intravenous immunoglobulin can be given, and for severe cases, plasma exchange can be given as well. The symptoms of this condition also start usually a week after the beginning of illness. One thing is important to note, that given the number of SARS-CoV-2 infections worldwide, the incidence of this condition is not particularly higher than what we had expected in the beginning. The other common or mild complications could be anosmia, which means lack of smell, ageusia, which means lack of taste, which are more common complications. These symptoms are reported more frequently with COVID-19 patients than for influenza patients, and can happen with other neurological complications as well. Stroke. So this is another complication which we should be aware of. Evidence has grown tremendously, and both ischemic, which happens from a blood clot, as well as hemorrhagic strokes, which happen from a bleeding, are possible. Most patients who have stroke are older than 60 years, but younger patients have also been reported. Why does the stroke happen? Remember, we talked about the inflammation which happens in COVID-19 infection. that inflammation can cause damage to the blood vessel wall, and that further increases the tendency to form blood clots, or called coagulopathy. What is the treatment? Blood thinners can be given, which can prevent strokes from blood clots. However, this approach must be balanced because it can increase the risk of bleeding type of stroke. So now that we have learned some neurological complication, let's take a look at some of the pictures. So this picture of the brain shows encephalitis, which is infection and inflammation in the brain. So as you can see, this part is shining in the brain, and that kind of points towards encephalitis. This is the dreaded complication of SARS-CoV-2, which is called acute disseminated encephalomyelitis, where you can see severe changes in the brain pointing towards the severe inflammation and infection. Lastly, this is a CAT scan of a stroke. As you can see, there is a dark area over here which is in the back part of the brain, which happened most likely due to a blood clot which went in and blocked the blood vessel which supplies the blood flow to this part of the brain. So now that we have learned the mechanism as well as the type of neurological complications, let's learn how prevalent are these neurological complications. So there have been a lot of studies which have given us the prevalence of neurological complications. However, in my opinion, the best study came out from New York City. And this was a prospective study where they studied neurological disorders in hospitalized patients with COVID-19, and they enrolled almost 4,500 patients. Out of these patients, 606, that's 13.5%, so almost 1 in 7, developed a new neurological disorder in a median of 2 days from COVID-19 symptom onset. Now, since we have already learned the neurological complications, let's see how frequent were they. So the most common diagnosis was encephalopathy. Stroke was almost 2%. Seizure was 1.6%, and hypoxia, which is lack of oxygen, was 1.4%. So the severe complications which I went over were not that much prevalent, but they have been reported a lot in literature. Now, one more important thing to take home is the patients with neurological disorders had increased risk of in-hospital mortality and death, and decreased likelihood of going home, and they had to go to a rehab facility. So now we have talked about hospital complications, which are the severe complications. Let's talk a little bit about what does it mean to be a coronavirus long hauler. I'm sure all of us have read or heard about this in the media or newspapers. So who is a long hauler? So some people can experience symptoms of the illness many weeks or even months after having it. 10% of people who have had COVID-19 will experience prolonged symptoms, which can happen up to 3 months after they were infected. Since this is 10% of people, we are expecting this will be a major chunk of the population. And this condition can affect anyone, young, old, person with chronic medical conditions, patients who were hospitalized, or even patients who were not. What are their symptoms? So the long hauler symptoms can have long-lasting symptoms, which include coughing, chest tightness, shortness of breath, headaches, muscle aches, and even diarrhea. The most significant symptom that is being seen across the board in coronavirus long haulers is fatigue. Many long haulers also report of brain fog, difficulty concentrating, or feel like they aren't as sharp as they used to be, and hence we expect that they are going to seek neurological help. So what can we do, meaning what can patients do as well as what can physicians do? So if someone tested positive or believes that they were infected at least 28 days ago and still experience symptoms, they should of course contact their primary care physician. Long haulers should go through extensive testing, which involves behavioral, pulmonary, respiratory, cardiovascular, as well as neurological. A care path and treatment plan should be formulated in accordance with their primary care doctors as well as their specialists, and they should monitor the progress of the patient going forward. What else can patients do to get over these symptoms? Of course, you can focus on improving your immunity by drinking plenty of fluids, being well hydrated, rest, focusing on good 7 to 8 hours of sleep, managing stress, and eating a well-balanced diet. What else can we do? I urge everyone to please get vaccinated. It is heartbreaking for me to see in my clinic so many patients are opting out of vaccination. I just want everyone to know it's okay to be scared. We always have fear of the unknown, but I think we have to give kudos to the vaccine scientists who have come up with the safe and effective vaccines so quickly in time, and we can all see the COVID-19 cases dropping. So definitely please talk to your primary care physician. If you have an underlying neurological illness, please you can contact our office and we can guide you in vaccination as well. So let's go back and revise what we have learned. So first we learned during this presentation that COVID-19 infection is not the only infection from viruses which can cause neurological complication. We learned a little bit of neurology by learning the basics of nervous system and what investigations and tests neurologists ordered. Why do neurological complications happen? Happen because of the severe inflammation our active immune system causes because it does not know how to deal with this virus. Types of neurological complications and their treatment. So we learned the various neurological complications. They can be minor, but they can often be severe. The severe complications are rare, but do happen. We learned the prevalence of neurological complications, and prevalence comes out to be approximately 1 in 7 patients with COVID-19 infection. We learned what it means to be a coronavirus long hauler, what are the persistent symptoms someone can face, and what we should do in order to get over this long hauler sickness. And finally, I have urged everyone to please get vaccinated as soon as you are eligible. Lastly, we can see light at the end of the tunnel. We are getting over this pandemic, but again, it's very important to not let our guard down. Please continue to wear masks. Vaccination is important. Focus on your health and well-being. Here at WVU East, we have a team of neurology providers, which includes Dr. Abhishek Anand. We have a nurse practitioner, Theresa Trix, and myself. My name is Apoorv Prasad. So if you are experiencing neurological symptoms and you would like to get evaluated, please ask your primary care physician to refer to our neurology clinic. Thank you so much, and please have a good evening.